tình những cuộc chương trình. Thì hôm nay rất là vui khi mà được bạn và được rất cùng được tham gia tham quan thì mời bạn giới thiệu. Mình là bác sĩ Phuong Binh, thứ hai trưởng khoa sức khỏe tâm lý của bệnh viện Phuong Huế. Mình công tác ở đây là trên 30 năm. Hiện tại thì cơ sở ở đây thì đây là khu vực điều trị của phòng sức khỏe tâm lý. Bên cạnh đó là có các cơ sở khám bệnh phân lạ ở bệnh viện Phuong Huế ở khu Hoai. Đó là hai nguồn để mà khám bệnh chữa bệnh ngoài trú. Còn bây giờ thì có phòng khoa tiếp nhận sẽ có bác sĩ Nhiên.
So after we met the head of the department, so we are moving to the room for outpatient treatments. So it is for the patients who come for examinations as well as the at-home treatments. So in this room we will have a interview session for you to understand more about the process, the organizational structures, as well as the missions of the department. Okay, so I don't know if you can hear the piano sound. So if you can hear or just imagine, okay, so I guess it's for the patient to relax. Okay, so we are at the room right now. Let's get started for the interview. Okay, so first of all, on the behalf of the project, I would like to give you my appreciation for joining us today. So can you introduce yourself to the students?
My name is Doan Thien. I am a psychiatric, a medical doctor from Mental Health Department of Huai Central Hospital, and I have worked as a psychiatrist for 3 years.
Okay, so can you tell more about the organizational structure of your department?
Yes, our department is as first it had the name that psychiatry department, and then it changed the name to mental health department. And we have Mr. Binh as the head of the department. He is the second degree psychiatrist. And Mrs. Binh as the vice head, also the head of psychiatry department of Huai University. And we also have 7 doctors, 10 nurses, 1 psychological bachelorette, and 1 paramedic.
According to the structure, what are the main functions and missions of your unit? I mean, your department.
Our department takes part in treating psychiatric patients from all over the ages, for all over the country, mainly from the Central and Central Highlands. But as we are from the specialized medical center, we often take the treatment for acute disorder or acute cases, and then send them to other smaller psychiatric hospitals for management.
Yeah. So what kind of mental illness do the patients who come for examination and treatment at the department suffer from?
There's a lot: schizophrenia, or depression, or mania, or anxiety, or stress, and just sleep disorder, and alcohol or illicit drugs abuses.
Yeah. So how is the process of examining, monitoring, and treating patients?
Because we are part of the general hospital, so the patients often come to our department are divided into 2 groups. One that comes with us with the directed psychiatric disorders such as schizophrenia with acute phases, or depression with suicidal behaviors, manias, or sometimes just get trouble in sleep. And the other group is from the other department in hospital. They has another psychiatric and sometimes psychological issues. And then the doctor of that department will fight, and we have consultations and then start treating them, maybe in their department or move them here for specialized patients.
Yeah. So, what are the difficulties, like in the process, and advantages in the process of treating and caring for patients?
Mm, First, I will talk about advantages. Mm, the hospital has paid the special attention to our department because they realizing the importance of the mental health. And we are general medical center, so we have consultations with other departments. And sometimes if patient has physical pain, we often consult with the traditional medicine or rehab department. And then we raising the trust in the patient. And to the other department, if the patient had organic psychiatric disorder, we can have them directly treating them. And we also have a great human resources because we are in a cooperation with the university.
What do you think about the quality of the facilities and equipment for examination and treatment here?
Oh yes, that's the disadvantages because our department is in the fixing and transition period. So we do have the needed equipment but cannot get it started, and we are using the old building for treatment. So it is doesn't meet the requirement. But we have a big yard. You need to see that for patient and the patient from our department, and we have required patient gather to do some activities, and we sometimes we do some activity therapy here.
Yeah. So is the current number of rooms and beds enough for the patient for receive the patients?
Absolutely yes. We have already expanded our department twice, and now we have 20 rooms, and with that size we can have about 50 patients. Yes.
Yeah. Thank you. So as you probably know that this is the first time that I have the opportunity to come here and learn about the Department of Mental Health. So to have a better view, right, of the patient examination as well as the treatment environment here, can you take me to visit the working rooms, patient examination treatment areas, and introduce to us?
Sure, follow me.
Yeah, thank you.
Okay, follow me.
Okay.
And this is one of our examination rooms.
So the patients, they come in for the first examination. So this is for outpatients, right?
Yes.
So can you tell me more about like how long does it take a patient to examine, like to get examined?
Mm, about 30 minutes. Yes, that's long.
Okay. So in the COVID-19 situation, so do your like does your department change the way of like examination and treatment as well?
Yes, the pandemic of course changes very much, but all the patients can get hospitalized, and our second branch of our hospital is big medical centers about treating COVID-19, so the patient can get in charge there, and then we indirectly treat them through the doctors who are there. And with the patient come to us regularly for examination, we have social media to get in touch with them. Like we give them our numbers or social contacts, and or just see them in the examination room instead of one month as regularly. We can tell them to see us in 2 months or 3 months.
Okay. So in your opinion, what mental health problems are on the rise in the current context?
Mm, of course, it is the anxiety and stress-related disorder.
That's it.
And yes,
Okay, thank you. And we are going to move to the main office, the main building of your department.
yes.
Can you show it?
Okay, sure. Let's go.
Okay. So as you can see that we are at the main office, the main building of the department. So this building is for inpatient treatments. Can you please introduce a little bit about the inpatient treatment, this building?
We have three examination room. One in OVA, one in the international pavilion that we've been and at the department this year, and one EEG room, one ECT room, and a small space for psychological testing and consulting, and of course one isolation room for COVID-19 waiting patients.
Yes. So can you tell us more about the treatments? How does your department treat inpatients?
We have pharmacotherapy and non-pharmacotherapy. Upon non-pharmacotherapy, we often take we have some therapy that we take for the patient regularly, like relaxation therapy and CBT. Besides, we have music therapy or activity therapies too.
Okay. So pharmacy, like therapy is that to give the medicines to the patients, right?
Yes.
Okay. So as you just said about the activities for the patient, right? So what are the activities that you set up for the patients?
We have the big yard that I've mentioned about. Sometimes we teach them some activities for relaxing and breathing and to get more healthier and more sunshine.
Yeah. So I can see that there are a lot of trees. So I think it's very refreshing for the patients to go out the rooms and like relax under the trees. So I would like to thank you again for having us for giving a tour around the department.
That's my pleasure.
So